Hey, I'm Jason Posner from the Plastic Surgery Channel, and I'm here with Dr. Barry DiBernardo from Montclair, New Jersey, and Adam Haroon from Vegas and Toronto.
Yes.
And what we're talking about is expertise. Who's an expert, who's not an expert, and why you should go to the experts. So Adam, why don't you lead off?
I think, one of the biggest challenges we see right now is with the rise of TikTok and Instagram and all these new platforms, it's really easy, for better or worse, for someone to create what I call manufactured credibility, right? Someone can hire a publicist, someone can do some influencer marketing, someone can, really make themselves seem like they've got all these credentials. When you look at behind that, what I call smoke and mirrors, you see their work isn't very good, they're not as trained, as some other surgeons who are board certified, and the patient, unfortunately, doesn't know any better. The layperson just thinks, all providers are created equal, and we know that's not the case.
I shouldn't go to a doctor because they have like 1 million followers on Instagram.
Right.
That would not be a good choice for me.
Right, people are shopping for doctors and surgeons in the completely wrong way.
But they do a better job because they have 1 million followers, right?
And this goes back to such an important marketing principle where I say perception is reality, right? Even though we know that's not the case, and 1 million followers does not mean they're going to have you come out looking proper, right?
What do you think, Barry?
You've been doing this as long as I have.
Too long, when I had hair. I used to have hair.
Many, many years. And throughout all those years, you learn and learn, and we did research. And
we go to meetings, and we're at meetings now.
Everything.
We sat at lunch talking about different techniques for X, Y, or Z.
But just take that knowledge base of what you know, and I'm going to talk about it in a different way, and that's problems. So if I go to you, and you operate on me, and you have a problem, you're going to need to you know how to get out of it. Your Instagram's not going to get you out of it, and
I can't find the answer on TikTok.
It's on Google, though.
Do you think if I dance around the operating room, that doesn't make me a better doctor?
I really think that does.
I think we should all dance. Come on, guys.
But here's a very simple analogy. Forget doctors. So you're on an airplane. The pilot, it's all on autopilot, and that's all running well. He's on TikTok and all. Great. But if that plane's in a thunderstorm, or it hits the wing or something, if there's a problem, you need to be safe, you need to get good results, and there's nothing that replaces experience.
We're really seeing what I call this return to expertise, and people now are actually doing that due diligence and saying, who's providing me with this information? Great, you've got 1 million followers on Instagram, you've got a blue check mark, but what backs up that, that facade, if you will, that we're seeing on social? What lies behind that? And I would just say, Instagram's great. It's a great tool to connect with patients. All of you, who are shopping for surgeons or who are surgeons should be there, but don't let that be the be-all and end-all of your search. It should just be a stop along the way. There's far more important places you should be looking. Again, like you said, Dr. DiBernardo, their credentials, their training, how many of the procedures that you're looking to have performed they've done. And again, look at their before and afters on Instagram, build a relationship with them there, get a feel for their personality and make sure it's a fit. But again, that should just be one step along the way and far from the most important part of your due diligence process.
Very wise.
Thank you, guys.
Thank you.
For Dr. DiBernardo and Adam Haroon and Jason Posner and the Plastic Surgery Channel, please follow us on theplasticsurgerychannel.com or go to our YouTube site.